Hey everyone, this is Dr. Kaufman, Clark the Chiro at Avad Chiropractic in downtown Goshen. We're coming at you with videos. I wanted to start these videos because it's a greater way to show a little bit more about what we do here, how we do it, and why we do it. So today's topic, we're going to be talking about low back pain. Now, low back pain affects 85% of the population. 85% of people will experience low back pain at some point in their life. That's a lot of people. Now, that could be a few days, or it could be a lifetime of pain. So it's a big problem for a lot of people, and as chiropractors, we help treat that type of thing. Now, we want to go over a little bit of how we treat it and what we look for in our office. So I have my spine model here, and what I'm going to show you is what we do, what I do when somebody comes in with low back pain. So first of all, I check the pelvic area. So this is the SI joint, and consists of the sacrum and the two pelvic bones for that. So if this, we consider this the foundation of the spine. So what that means is, just like a house, if your foundation isn't correct or stable, if it's cracked, then you're not going to build upon it. At least I hope not. So this has to be stable and in alignment in order for everything else above the spine to work the way it should. So how we check that is we look for the level of the crest, which is right here. So if one is higher or lower than the other, that's an indication that there might be something going on, as well as check the joint itself for sponginess. And what that means is it's like a sponge. You press into a sponge and it comes back. So it gives and it comes back. And so that's what we look for as far as that joint. That is, if there is no sponginess, if there is no feeling of motion in that joint, then it's stuck. It needs to move and restore motion. As well as this, the lumbar spine right here. That's what we feel for as well. You know, if there's a misalignment that is causing a lack of motion, then we need to restore motion in that joint. So if the pelvis is misaligned and not moving correctly, you can feel it in the lumbar spine, even all the way up here if it becomes chronic. As well as the knee. You could have knee pain from this because it's, that's how you walk. You need to be able to move this joint properly to be able to walk correctly. So that's just a little bit of what we check for, and I check that on every patient because it is the foundation. And when your foundation is solid and moving correctly, then above the spine and below into the extremities can work more efficiently. Now that's not the whole case. It's a little more complex than that, but it's all about how you move and interact with your environment. And if you're not doing that very well, you experience pain. So that's what we as chiropractors do, is we restore motion to the joints so that you can experience health and better pain-free movement. And I love what we do. I'm very passionate about this, and I love helping people achieve things in life that they want to achieve. And that starts with health, and that starts with movement and being able to do things like that. So if you like this video, like it, share it, visit our website. That'd be great. This is Clark the Chiro at Avad Chiropractic.